Contemporary studies, including one from our group, have investigated outcomes after non-cardiac surgery and found that patients with severe aortic stenosis have comparable 30-day mortality rates to matched controls, albeit with some increases in major adverse cardiac events. However, no studies to date have compared the incidence of death or major adverse cardiac events in severe aortic stenosis patients undergoing non-cardiac surgery with and without aortic valve replacement prior to their non-cardiac surgery. It was interesting to note that at 30 days, there were no significant differences seen between both groups in the incidence of death, myocardial infarction, ventricular arrhythmias, or stroke.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.